we're all super busy, right?
Yeah.
Trying to keep up with everything, know what's going on without it, like, taking over our lives. That's kind of what we try to do here on the Deep Dive, give you the need to know on important stuff. And today we're talking about something that's actually incredibly common. But a lot of people who have it don't even realize it. Prediabetes.
Prediabetes. Basically, it just means your blood sugar is, like, a little high. Not high enough to be officially, diabetes. But still, it's not really where you want it to be. And the crazy thing is the CDC estimates over 96 million Americans have prediabetes. That is a lot of people.
96 million. Wow.
And get this, almost 80% of those people don't even know they have it.
80% are walking around totally in the dark.
Yeah.
That is a serious wake-up call. And look, we're not doctors here, obviously, but we are going to deep dive into some really interesting findings from an article written for, medical professionals. It's called Prediabetes Risk Factors, when it's obvious that the patient could be in trouble. And it's from Diabetes in Control, which is a great resource.
Oh, yeah, it's a good one.
So we're going to go through it and pull out what we think are the most important takeaways for you guys, our listeners. Things that might help you spot early warning signs, things that you might not even be thinking about. Because as this article points out, if you catch prediabetes early enough, you can often reverse it.
Right, exactly. And that's the goal, isn't it? To catch it before it becomes a bigger problem.
Absolutely. So think of this deep dive as like giving you some extra knowledge, some ammo,
Yeah.
so you can have a better, more informed conversation with your own doctor, right?
Right, yeah. Like, giving you the information you need to be your own best advocate.
Exactly. Okay, so let's jump in. So this article starts out by talking about some of the more, I guess you could say, obvious clinical risk factors for prediabetes. And right at the top of the list are these, slightly elevated blood sugar levels. Specifically, fasting blood glucose levels between 100 and 125 milligrams per deciliter, right, MGDL. And then also a hemoglobin A1C value between 5.7% and 6.4%. And you might see one of those numbers on your lab report, and you might be like, oh, okay, it's a little high, but you might not think much of it.
A lot of people don't.
Yeah. But what's really interesting is that the article points out that when those slightly elevated numbers show up alongside other conditions you might have, that's when doctors really start to pay attention.
Right, because it all starts to add up. Like, you see one thing, maybe it's not a huge deal, but you see a few things together, it's like, okay, wait a minute.
Right. So what kinds of things are we talking about? What other conditions?
So the article lists a history of hypertension, which is, high blood pressure. It also mentions dyslipidemia,
which is
basically means your cholesterol and triglycerides. Those fats in your blood, they're out of whack. Not good. And then it also mentions polycystic ovary syndrome, or PCOS.
PCOS.
Got it. So if you've got any of those conditions going on and you see those slightly elevated blood sugar levels, that's when the red flags start going up for doctors.
Because it's like all these things are connected, right? Like they're all symptoms of some kind of underlying issue.
Exactly. It's like, okay, maybe there's a bigger problem here that we need to address.
Right. Okay, so moving on. The article also talks a lot about obesity, specifically what they call central obesity. So like that extra weight around your middle.
Yes, the belly fat.
Yep. The article defines this as a waist circumference over 40 inches for men and over 35 inches for women. And what's interesting is it says that insulin resistance, which is basically when your body's cells stop responding to insulin the way they should.
Meaning they don't take up glucose from your blood as efficiently.
Right, exactly. It says that often exists before blood sugar levels even reach the pre-diabetic range.
Yeah, that belly fat is a big problem. And it's not just about, looking a certain way. It's about what that fat is doing inside your body.
Oh, yeah, for sure. It's not just cosmetic.
Right. So fat cells, especially those around your abdomen, they release these hormones and other substances that can mess with how well your body uses insulin. So a larger waistline is often a sign that those metabolic changes are already happening, even if your blood sugar isn't quite in the pre-diabetic range yet.
It's like a warning sign that something's off.
Exactly.
Okay. And this leads to the concept of metabolic syndrome, which the article says is even more telling than just looking at individual lab results on their own.
Yeah, metabolic syndrome. It's kind of like a cluster of different things that together increase your risk for all kinds of nasty stuff. Heart disease, stroke, type 2 diabetes, the whole 9 yards.
So what are the components of metabolic syndrome? Like, what are we talking about here?
Well, it usually includes high blood pressure, high blood sugar, unhealthy cholesterol and triglyceride levels, and of course, excess abdominal fat, that belly fat we were just talking about. So it's not just about looking at one thing in isolation. It's about looking at the whole picture, all these different factors together.
Got it. So it's like a pattern rather than just one individual thing being off.
Right. And it's a pattern that's been linked to a much higher risk of developing serious health problems.
Okay, that makes sense. Now, another really important risk factor that the article talks about is family history. So if you have a close relative, like a parent, sibling, or child, with type 2 diabetes, your own risk of developing prediabetes goes up significantly.
Yep. Family history is huge. It's partly genetics, of course. Some people are just predisposed to developing these kinds of conditions. But it's also about lifestyle, right? Families tend to share similar habits, eating patterns, activity levels, those kinds of things.
So even if you can't change your genes, knowing your family history can still be super valuable.
Oh, absolutely. It can help you and your doctor make more informed decisions about your health. Like, if you know you have a family history of type 2 diabetes, and you're also carrying some extra weight around your middle, that's a pretty clear sign that you need to be extra vigilant about your lifestyle choices.
Definitely. Okay, so we've talked about some of the more direct clinical risk factors. But the article also goes into the role of lifestyle and environment, which, luckily for us, are things we often have some control over.
Yeah, this is where we get into the things you can actually do something about. And the article highlights a few key areas, like being sedentary, sitting for long periods of time. It says that if you're sitting for more than 8 hours a day, that can really increase your risk.
Yeah, that makes sense. When you're sitting all day, you're not burning as many calories.
Yeah.
Okay? And that can mess with your insulin sensitivity.
Exactly. And then there's diet, of course. The article talks about how diets high in sugar and low in fiber are major contributors to prediabetes.
Yeah, all that sugar without the fiber to slow down its absorption. It's like a recipe for blood sugar spikes.
Exactly. And those constant spikes aren't good for your body in the long run.
Okay, so we've got being sedentary in diet. What else?
Well, the article also talks about something that people often underestimate: sleep and stress.
Oh, yeah, those are biggies.
Huge. If you're constantly stressed out or you're not sleeping well, it can really throw off your hormone balance. And that, in turn, can disrupt how your body handles glucose.
It's like a domino effect, isn't it? Stress and lack of sleep lead to poor food choices, less motivation to exercise. It all kind of spirals.
It really does. And over time, even what you might consider moderate stress, if it's chronic, can contribute to insulin resistance.
Interesting. So it's not just the big dramatic stressors. It's the everyday stuff that can wear you down over time.
Exactly. And speaking of things that wear you down over time, the article also takes a broader look at the impact of our environment and socioeconomic factors on pre-diabetes risk.
Yeah, this is really important. The article talks about things like access to healthy food, safe places to be active, and quality health care. These aren't just individual choices, are they?
No, they're not. They're often systemic issues. And they can create huge obstacles for people who are trying to live a healthy lifestyle. Like, if you live in a food desert where there are no grocery stores with fresh produce within miles, how are you supposed to eat a healthy diet?
Right. And if you live in a neighborhood where it's not safe to go for a walk or a run, it makes it that much harder to get the exercise you need.
Exactly. So while individual choices are important, we also need to acknowledge that the environment we live in plays a huge role in our health.
Absolutely. Okay, so moving on. The article also highlights some specific populations that healthcare providers should be particularly aware of due to a higher inherent risk of prediabetes.
Right. So we're talking about certain racial and ethnic groups, including non-Hispanic Black, Hispanic Latino, Native American, and Asian American individuals.
And why is that?
Well, it's a combination of factors. Genetics plays a role, for sure. But it's also about disparities in access to healthcare, preventative resources, and those environmental factors we were just talking about.
Right. It's like all these things kind of stack up against certain groups of people.
It's unfortunate, but it's the reality.
Okay. So we've got those racial and ethnic groups. What other populations are at higher risk?
Well, age is a big one. The article says that adults over 45 should generally get screened for prediabetes regularly, just because the risk tends to go up as we get older.
Makes sense. Anything else?
Yeah, the article also brings up a concerning trend: the increasing rates of prediabetes we're seeing in teenagers.
Teenagers, wow. That's young.
It is, and it's largely linked to the rising rates of childhood obesity, which is another whole issue. But yeah, it's something we need to be paying attention to.
Definitely. Okay, and then finally, the article talks about women who have a history of gestational diabetes.
Ah, yes, gestational diabetes. So that's diabetes that develops during pregnancy. And the article says that women who have had gestational diabetes have a much higher risk of developing type 2 diabetes later on. Like, we're talking a 35% to 60% chance of developing it within the next 10 years.
That's a pretty significant increase.
It is. So it's super important for women who have had gestational diabetes to get screened regularly after their pregnancy and to really focus on those healthy lifestyle choices, diet, exercise, all that good stuff.
Okay, so we've talked about a whole bunch of different risk factors for prediabetes. Now, keeping all this in mind, what does the article say healthcare providers should actually do? And maybe even more importantly for us, what can we learn from those recommendations?
Well, the big thing the article emphasizes is early detection. Catching prediabetes early is key. And that means doctors and other healthcare providers need to be proactive about screening.
So what does that look like? Like, who should be getting screened?
The American Diabetes Association recommends that anyone with a BMI over 25 or 23 for Asian Americans and at least one other risk factor should be screened regularly.
BMI over 25, okay.
But it's not enough to just screen people, right? You have to do something with those results.
So what kinds of things are we talking about? What should happen after someone is screened?
Well, the article stresses the importance of personalized lifestyle changes. It's not a one-size-fits-all situation. So healthcare providers should be working with their patients to develop plans that are tailored to their individual needs and circumstances.
That might involve things like nutrition counseling, exercise programs, that kind of thing.
Exactly. And the article specifically mentions the CDC's National Diabetes Prevention Program, or NDPP, which is a great resource for people who are at risk for developing type 2 diabetes.
Oh, yeah, I've heard of that.
Yeah, it's a really good program. And it's been shown to be very effective in helping people make those lifestyle changes and prevent or delay the onset of type 2 diabetes.
Okay, so that's something for our listeners to keep in mind. If you're concerned about prediabetes, you can ask your doctor about the NDPP.
Exactly.
Now, the article also points out that even small changes can make a big difference.
Oh, absolutely.
Like losing just 5% to 7% of your body weight and getting around 150 minutes of physical activity per week. Apparently, that can reduce your risk of developing type 2 diabetes by almost 60%.
That's huge. It's like you don't have to completely overhaul your life to see results. Just a few small tweaks can make a real difference.
That's encouraging.
It is. And the article also briefly mentions how technology can be helpful in this process, like continuous glucose monitors, those CGMs, and wearable fitness trackers.
Oh, yeah. Those are becoming really popular.
They are. And they can be really helpful in giving people real-time feedback on their progress and helping them stay motivated.
And finally, the article talks about the importance of communication, like making sure that healthcare providers are communicating with their patients in a clear and culturally sensitive way.
Right, because, a lot of people might not even realize they're at risk until it's too late.
So it's about making sure people understand the risks and what they can do to protect their health.
Exactly. And that means meeting people where they are and explaining things in a way that makes sense to them, given their cultural background and their individual circumstances.
Makes sense. Okay, so to sum it all up, the big takeaway from our deep dive into this article on prediabetes risk factors is this. Spotting those risk factors early on is absolutely crucial for preventing type 2 diabetes.
Couldn't have said it better myself.
And we really encourage you guys, our listeners, to take a moment to reflect on the things we've talked about today. Think about your own health, your own lifestyle, your own family history. Are there any red flags popping up for you?
And remember, we're not giving medical advice here, but we are trying to empower you with information so you can have more informed conversations with your own doctor.
Exactly. If you're interested in learning more, the article mentions a couple of great resources. Diabetes in Control is a good one for healthcare professionals. And for patients, there's health.healingwell.com. Both of those websites have a lot of great information on prediabetes and diabetes.
And with that in mind, thinking about how everything we've talked about today, our lifestyle, our genes, even the communities we live in, all play a role in prediabetes. Here's a final thought for you guys to chew on. What's one small informed step you could take today to become a little more aware of your own metabolic health?
That's a great question. Something to think about. And on that note, we're going to wrap up this deep dive. Thanks for listening, everyone. We'll see you next time.